Hey, it's Ian Hart, and after helping hundreds of people who suffer from painful sciatica and battling myself when I was younger, I can tell you there's probably no more aggravating form of back pain. Sometimes you can't sit, sometimes you can't stand, sometimes you can't walk or drive or even lie in bed. The pain is simply wretched. A couple days ago, a woman came into our clinic on her hands and knees. It was the only way she could really find any relief. She was in tears. The pain radiating down her legs was unbearable. And she inspired me to shoot this video. So today I'm going to tell you what I told her. Every week, my clinics and programs are a destination for people from all walks of life who suffer from sciatica. And the first thing you should know is this: sciatica is not a disease. That's right. Allow me to be clear about this because it's very important. Sciatica is not a diagnosis. If you see a doctor and they tell you that's what you have, you're not being told the whole truth. And, by the way, I have doctors who are in pain who visit my clinics on a regular basis, so I know. Let's put it this way. Sciatica is a symptom. The doctor is only labeling a symptom. They're not telling you what is actually wrong. Now, when they put a label on your pain, I totally get how good that makes you feel in that moment. So what happens next? They prescribe some heavy-duty ibuprofen to calm the inflammation, to calm the pain. Maybe they ship you off to a physical therapist, and then they're on to the next patient. And we already know how that works, don't we? Let's face it, the reality is a lot of doctors fail to fix their sciatica patients. They come back time and again with the same pain, the same issue, the same cry for help. The doctors eventually begin to wonder whether the patient even wants to get better. Imagine that. It doesn't occur to them. It could be the treatment that's not working. And that's because their sciatica diagnosis is just an easy way of sending the patient home happy. For the record, sciatica is the term that describes symptoms of pain that begins in the lower back and extends down through your butt, thigh, and sometimes even as far as your foot. Most likely that tingling or painful sensation going down your leg is caused upstream in your spine, such as irritating, compressing, or pinching degenerative disc disease causing vertebrae to hit a nerve, or a facet joint at the back of the vertebra which is out of alignment, a strained back muscle spasming and painfully squeezing a nearby nerve or a nerve sheath. Multiply these issues by the number of vertebrae and muscles in the back, and you can start to appreciate how much work it can be to diagnose the problem accurately. Even with new technology such as MRIs, which is why most doctors feel they're doing the best they can given the resources available, that's why I prefer to take a more self-directed, holistic approach to addressing sciatica. So how do we fix the pain and the numbness? Recently, a young mother came into my clinic. Even after years of chiropractic treatment, for some reason, she still suffered with sciatica. Actually, I was rather shocked to think if a young mom can be dealt a crippling back pain blow, what does this say about the rest of us? Here's Patty's inspiring story in her own words. I think it'll inspire hope if you're also suffering.
I had constant back pain since my child was born. He's 14 now. My sciatica was an issue, my hip, shoulder, and my neck as well. I saw a chiropractor for about 4 years, twice a month. And I still had issues with it flaring up. When it did flare up, I was down and out for about 3 months at a time. My life was just working and coming home trying to manage the pain. My family was pretty much without me during that time. I wasn't able to exercise, gained a lot of weight, and was pretty much scared to do anything besides work to make it worse. I was skeptical about using the Back Pain Relief for Life program just because I didn't want to injure myself anymore. I felt like doing nothing or only seeing the chiropractor was the way to get any relief. It's been great. I have had no muscle pain at all. I have not had to see the chiropractor once. I exercise, I'm able to be active, work. I have no neck pain, shoulder pain. When it was really bad, I couldn't even grocery shop. Just standing on a concrete floor in the grocery store hurt so bad. I could just get 1 or 2 items at a time. When I do the program, I can feel, it feels as if my back, my neck, my shoulder just gets that same adjustment that I used to get from the chiropractor. So it's been wonderful. It's great.
Okay, so how did I help Patty? Or maybe more aptly, how did Patty help herself? She did 8 specific movements. These 8 movements are totally unlike the sheets of exercises you get from chiropractors or doctors. Instead, we wake up certain muscles and restore muscle balance. That's the key. Then, in certain areas of her back, we jump-started pathways so vital oxygen and nutrients could get in and help her heal. That's the holistic way to relieving sciatica. It's not uncommon, but in Patty's case, it took just a couple sessions. A couple sessions and she was completely out of pain. Yes, there are ways to get out of pain. They don't require medication, surgery, or injections. They don't require months of physiotherapy. You just have to restore your body's natural, functional movement and muscle balance and allow it to heal naturally. My name is Ian Hart, and I'm the founder of MyBackPainCoach.com. And if you're plagued by constant back pain and want to learn more about a fast, natural way to get immediate relief, go ahead and click the link on this post right now. And I'll see you on the other side.